Maria, welcome to Inside GITEX podcast. How are you?
I'm great. Thank you for having me today.
It's an absolute pleasure. So obviously I've detected a bit of a twang. Where are you from?
A twang?
Yes.
Well, I am from the U.S.
Okay.
I've lived all over the U.S., New York, Atlanta, L.A.
But you've moved recently to Dubai?
I have. I've relocated to Dubai, and I am loving every minute of it.
Amazing, amazing. First time coming to GITEX, or you've been here before?
It is my first GITEX. I'd heard about it before. It was always on my radar of things to do, and really excited to be here today.
What are your expectations?
I just want to see the most creative innovations in the world. As an investor, I'm always looking for something that's going to transform the world or, change things. And you can see that here. There's so many smart people with innovative technologies that I haven't seen before from all across the globe. Yeah. And that is really unique. And that's what I'm really looking forward to.
You're in the right place, Maria. You're in the right place. So talk to me a little bit about Steelsky Ventures. What do you guys do in a nutshell?
In a nutshell, Steelsky Ventures invests in companies that are on the forefront of AI healthcare.
Okay.
We're looking to invest in companies that are underinvested. So instead of creating 57 of the same flavor of companies, we're looking for companies that are innovating in new categories of investment in healthcare.
Okay. And you talk a lot about moonshots, right? So in your eyes, what makes a moonshot in healthcare?
I think a moonshot is something that people are afraid to do. People know it should exist, but their founders just aren't bold enough or have the vision or the capacity to do that. And so we're looking to partner with founders that want to shoot for the moon. They want to create something that hasn't been created for yet. And so we're looking to assist them in doing that. And so when we're doing that, we're looking for founders with grit, founders with vision, founders that are quite risky. In healthcare, to really make change, significant change, you have to take risk. And so we're willing to do that with our founders. So for instance, we invested in a drone delivery company who's delivering medical supplies to Africa.
Amazing.
Before it even was able to get to the US, before it had any approval, we believed in this new vision because it was able to save the lives of over 15,000 women from bleeding out from childbirth. Because instead of having 4 hours and bumpy African roads, you could deliver medical life-saving products to these women within 40 minutes.
That's
and
amazing.
They were able to reduce the maternal mortality rate in Rwanda by 88%.
That's amazing. I mean, look, the idea of moonshot, it sounds great, right? It's very nice, it's PR friendly, but the reality is actually going out and backing it and doing it. So the fact that you've been able to do that is fantastic. What are your plans for moonshotting here in the region?
In the region, there's a lot of opportunity. There's an interesting population mix here. There's a lot of expats here. There's a lot of private insurance. There's a lot of people who are really into healthcare. So I think longevity and wellness is a really amazing opportunity in this region.
Okay, very cool. And we talk about sort of unlocking new markets. So what does an untapped market look like in your eyes?
So one of the untapped markets that we had found in the US was in women's healthcare specifically. Because 90% of venture capitalists are men, they're investing in things that they understand. The other 10% are women like me, and we want to invest in things meant for us. So we have started looking at those types of categories, investing and inventing new categories that have not been invested in yet. So for instance, we basically invented the pelvic floor physical therapy platform. So we had invested in a platform in a category that hadn't been invested in before. And now she has over 20 locations in the US.
Amazing.
We invested in the first virtual menopause clinic called MIDI Health. And now they're treating over 20,000 women a week. So when you find categories that are underinvested or uninvested, you have an opportunity to create massive alpha.
You know what I love is your passion in this. It obviously means a lot. So it's more than just a job.
It is. It's a calling.
So why are you doing it? What's the reason?
The reason is when I don't see something, I want to build it. I've always been an entrepreneur from a very early age, and I want to leave my mark on the world in a way that, people knew I was here and that I did something great.
So amazing. What are the signs that when you see these founders, right, and you can see the look in their eyes? So what takes it from, a health startup that's got a great idea to really dramatically scale it up? Like what's that trigger? What's that catalyst?
The catalyst is the grit and the drive and the perseverance. We usually look for founders that might have done this before. Maybe they were mildly successful, but this time they really want to knock it out of the park, and they have the tools and the experience to do it.
Okay. So talk to me now a little bit about data privacy, right? How does a company build a fair, privacy safe and have a data edge without sort of locking people in?
That's something that you have to think about early on in the foundation when you're building the company, having the right security controls in place. And now with AI, as you know, things can get very risky. And you want to make sure that you have an AI that is culturally competent too and ethical. And so we're having all of these types of conversations because right now it's a very nascent world of AI in healthcare. And so we're framing what that is going to look like going forward.
And the regulations in this market could be very, very different somewhere else. So how do you then navigate that if you want to deliver a global scale?
You have to have a lot of great partners, a lot of lawyers, a lot of regulating partners. And so we're always talking to our regulators in DC. We're talking to them and really have to be involved in government and the policy. And sometimes you can even be involved in shaping that policy.
Yeah. So talk to me now about your go-to-market strategy, right? What really lands, what sticks? Like, what are some of the top tips, tricks that you can sort of give us when it comes to, your clinics, employers, insurers, retail, all that jazz?
Understanding your consumer is the number one thing that you have to do first. That is the only way to be successful, is to be customer obsessed. And you've heard it from the brilliant CEOs and billionaires. They're always customer obsessed. Those are the people who can win in the market. When you really understand your customer, what they want, how they want it, where they want it, you can really drive penetration in the category.
So let's talk about your customer. What do they want?
Our customer wants products that are built for them. They want to be able to trust the healthcare that they're getting because so many people can't trust the doctors. A lot of people have been hurt by medical systems and they don't trust the systems. And so we want to find a way for them to feel comfortable and know that they're getting equitable quality care.
How do you feel this region? Because you've been here, only a handful of months. How does this region compare with being back home, being back in the US?
Well, both systems have their pros and cons, but I've really had a great experience here. The limited experience that I have had have been really great. And I really like the focus on integrative care and integrative medicine here and preventive care and the use of digital technologies and AI.
So we mentioned AI a few times. So how do we make sure that AI is not being used as some sort of nice buzzword, right? And it's not just fluff, but it actually delivers better outcomes. So how do we make sure that we can avoid the fluff and the PR and actually deliver on the better outcomes for the patients or from the end consumer?
You're exactly right. We hear AI at the end of literally every startup is something AI. And so you really have to sift through what's real and what's not. AI for the sake of AI, chatbots, okay, those have been done. What we're looking for is how do you streamline operations? How do we triage clinical care? How do we add capacity to health systems using AI? There's a lot of different ways to use AI than the traditional, what you'll see coming out of NVIDIA or these large computing companies. And so we're trying to look to see how AI can really scale in the markets that we serve.
Do you think we're a bit of an AI bubble right now?
100%.
So what's going to happen? Is it going to burst? Is it going to be reconciled? What's the outcome?
It's going to be like the internet. It is the wave of the future. It might not look like it does today, but it will be the underpinning of all technologies moving forward.
You think we'll be able to make some ROI from AI?
100%, and I plan to make a lot.
I can see that. I love the confidence and I love the passion. Why Steelsky Ventures? Why that name? What's the reason behind it?
Well, I was living in New York at the time, and I was on the Jersey side and looking at the landscape from my balcony, which was a sky full of steel.
Yeah.
And it also kind of just shows what we were looking for in the types of companies that we want to invest in. We're looking for companies that are shooting for the sky. The sky is not the limit. The sky is something that we feel just evokes a nature of people who want to shoot higher and shoot out of this world and make great change.
You are in the right city. You are also in a bit of a steel jungle, but we have some of the most ambitious leaders in the world, really clear vision. How much do you feel like what you're trying to do in the private sector is aligned with the public sector interests?
It is very much aligned. And that's one of the reasons that I came here. I was meeting with a lot of the healthcare innovation leads in the country and have just found a passion and an intersection of what they're doing. They are just as passionate as me about making change in healthcare. And so it's nice to be in a city that's full of energy and wanting to make innovation and change.
Love it. So a couple of last questions. Insights-wise, what is your own personal insight as Maria? The work that you've been doing, the experience that you've amassed, what is the insight that not many people will really get or understand in this industry and what you're doing?
People think healthcare is really hard, and it is. But you have to be bold and you have to invest in new ideas if you're ever going to have that change. And so a lot of people are like, oh, I would never do healthcare. I want to stay away from it. It's regulated. But it can save lives. And when you're saving lives and changing and improving people's health, that is one of the most precious things that you can do in this world.
Love it. Bringing it back to GITEX as a close, what are you expecting over the next few days?
Well, I'm speaking tomorrow, so I'm expecting a very big audience.
Good luck. I'll be there.
And a standing
if
ovation.
I'm not filming, I'll be there, front row.
Yes, so I'm just looking forward to meeting a lot of other investors, amazing companies, strategic corporations that we could partner with going forward.
Amazing. Maria, it's been great having you on. Thank you for joining me on Inside GITEX, and I wish you all the very, very best.
Thank you.